Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty, and today we will be discussing about the cardiomyopathy. And cardiomyopathy is also a short question. Either it can be asked as a short question or either it can be asked as a long question also. Okay, let's start. So what are cardiomyopathy? They are nothing but a heterogeneous group of disease. Okay, they are nothing but the heterogeneous group of disease characterized by the electrical dysfunction. There is electrical activity of the heart is basically getting disrupted. Okay, there is a dysfunction. It is due to mainly the genetic causes. So what happens is there is the restriction in certain parts of the heart. There are certain parts of the heart which are not able to function properly, as a result of which this disorders occur. Okay, there are many disorders under the cardiomyopathy that we will read. They often lead to the sudden cardiac deaths also. Okay, let's learn about the epidemiology that you have. So global incidence of this disease is around 1 in 250 to 1 in 500 in adults. Okay, not that common, but the most common cause of heart failure in young adults. Heart failure is the most common cause, and I know you have read many newses out there which states that young adults, the most common, the most leading cause of death is due to the any heart disease, right? You have certain classification for this according to the WHO, the World Health Organization. The classification that you have, first one is you have the dilated cardiomyopathy, then hypertrophic cardiomyopathy, restrictive cardiomyopathy, and the arrhythmogenic right ventricular cardiomyopathy, and the unclassified one. Okay, in the unclassified one you have the left ventricular cardiomyopathy, non-complicated cardiomyopathy, 𝗲𝗵𝗵𝗵𝗺 cardiomyopathy, and the peripartum cardiomyopathy. These are basically the classification that you have. Let's learn about the dilated cardiomyopathy. What happens here? There is a progressive cardiac dilation and the contraction. There is systolic. The systolic phase of the heart is getting compromised. See this figure. In this figure, what you are able to see, that the heart muscles are basically weakened. The heart muscles are basically weakened. Okay, and there is enlargement of the left ventricle that you are able to. What is the etiology behind it? 30 to 50% is due to your genetics. Okay, there is mutation in the cytoskeletal proteins, and acquired ones are due to any viral infection like the 𝗲𝗵𝗵𝗵𝗵, HIV, or the Chagas disease. And I have told you that you have to read the Chagas disease from your microbiology. Okay, then what are the other causes? Maybe the person is an alcoholic, right? And alcoholic, I have told you, if you don't know the etiology of the disease, two things are very, very common. What? Alcohol, smoking, and sedentary lifestyle, right? They three are the main heroes of everybody's life. Okay, they destroy your life. Then you have the certain drugs, and the pregnancy. In the pregnancy you have the peripartum cardiomyopathy due to the nutritional deficiency. Let's see what is the pathogenesis you have. First one, there is sarcomeric dysfunction. You know what the sarcomere layer that you have in your muscle, that get impaired, and there is systolic contraction. The ejection fraction of your heart is reduced to 40%. Ejection fraction of your heart is reduced to 40%, and we have read when we were reading about the heart failure, we have read about the ejection fraction as well. Then there will be ventricular remodeling, as a result of which there will be mitral and tricuspid regurgitation that will occur. And arrhythmia means irregular heartbeat, and then the person will finally end to sudden death. In the morphology, see, in the morphology one now, just remember the gross figure very well and the histopathology also. But in the gross, if they ask you in the spotting in your pathology practical exam, you should be able to identify it. Okay, so in the gross, you are able to see that the heart is enlarged. You have the flabby heart, and the normal weight is around 2 to 3% is the normal weight of the heart, right? Then you have the dilation of all the chambers. See, here you are able to see this chamber is basically getting enlarged. Okay. Then in the microscopic, you are able to see the hypertrophy. You are able to see intestinal infiltration. See, you are able to see some blue cells inside it, right? That is nothing but your interstitial inflammation, right? Next, what are the clinical features you have? It is mainly common in the age of 20 to 50 years. What are the symptoms you have? Either the person can have dyspnea, orthopnea, or fatigue, right? Arrhythmia will be there and the embolic events will be there, and finally the patient will result in sudden cardiac death. Next, what are the investigations you will order? Firstly, what you will order is the chest x-ray. In the chest x-ray, you are able to see that there is enlargement of the chamber of the heart, right? Then you will order the echo. In the echocardiogram, you are able to see that the left ventricle of the heart, see, I have told you in this figure now, the left ventricle of the heart will be getting enlarged. The left ventricle of the heart will be getting enlarged. So in the echo also you are able to see the dilated left ventricle. In the ECG you are able to see that you will be having arrhythmias. There will be irregular rhythm which will be there. In the MRI you will be able to see the fibrosis. The prognosis is mainly poor. 50% chances are there that the person may die. 50% mortality chances are there. Complications are that it can result in the heart failure, arrhythmia, and embolism can be there. Now, what is the treatment? The standard treatment is basically to give the diuretics, to give the ACE inhibitors, and to give the beta blockers, right? Then you have to give the anticoagulants. If there are any thrombus formation or the blood clot is getting accumulated, you will give the anticoagulants to that person. And finally, if nothing works, then transplantation comes into the action, right? Next, let's read about the hypertrophic cardiomyopathy. What is hypertrophic cardiomyopathy? It is the myocardial hypertrophy. The myocardial are what? The muscles of the heart. So muscles of the heart here are getting inflamed. Now what happens is the LV outflow obstruction. There is when the muscles of the heart get this inflamed, hypertrophied, right? So what happens now? There is a LV obstruction. The left ventricle obstruction will be there, right? Etiology, genetic. It is 100% cases are genetic. Okay. What is the most common one? You have the beta myosin heavy chains are involved, and then you have the troponin T. What is the pathogenesis behind it? What is the pathogenesis that you have? First one, there is sarcomeric dysfunction. In the dilated one also we have seen. The first one is the sarcomeric dysfunction. Then you are having the hypertrophy of the C. Then you are having the hypertrophy. As a result of which, what is happening? There is a decrease in the left ventricular compliance, right? And then there will be obstruction. And I have already told you, if the four-way vehicles are coming to a one-way, what will happen? There will be obstruction. Similarly, there is obstruction in the left ventricular also, and that will result into the ischemia. What is ischemia? You have to tell me, right? Let's see the morphology. In the morphology, you are able to see what? A banana shape. See, it resembles to your banana. It is a banana shaped LV cavity that is there. So if in your spotting it is, this figure is kept, then you should be able to identify it very, very clearly, right? Then you are, in the microscopic one, you are able to see the myofibers and the intestinal fibrosis. The myofibers, you are able to see, these are nothing but your myofibers that you are able to see, and you are able to see the intestinal fibrosis. What are the clinical features you have? What are the clinical features that you will be having? First one is, this disease mainly occurs in the young people who are athletes or who are involved in rigorous activities. Okay, so whenever they will give you the case now, they will mention that there is a young adult, he was going for a running or he was participating in a marathon, and like this they will give you the case. So what are the clinical features you will be having? You will be having dyspnea, angina is what? Chest pain, syncope, and there will be systolic murmurs that you will be hearing. Okay, investigations that you will order. First one is the echo. In the echo, you are able to see that there will be asymmetrical septal hypertrophy, and in the ECG you are able to see the left ventricular hypertrophy. We have two disorders, dilated and the hypertrophic. In both we have seen that there is involvement of the LV, there is involvement of the left ventricle. In the dilated one, what was happening? There was enlargement of the left ventricle. In the hypertrophy, there is the heart muscles are getting inflamed, as a result of which there is obstruction in the LV. So this point you need to keep in mind. And whenever you are eating banana, what should come to your mind? Hypertrophic, right? Next, let's see about the complications that you have. It can result in the sudden cardiac death. On-spot death can happen. There can be atrial fibrillation. What is the treatment that you will give? You will give the beta blockers first, then the 𝗵𝗵 that you will give. Diuretics. If there is obstruction, obviously you have to give the diuretics, right? Next, we will be talking about is the restrictive cardiomyopathy. So what happens in the restrictive cardiomyopathy? In the restrictive cardiomyopathy, there is stiff wall. The heart muscles are basically getting stiffed. Okay, as a result of which what happens is the diastolic filling is there. In the above disorders that we have discussed, we have seen that there is systolic impairing. Now here there is diastolic impairing that is occurring, right? See this figure, this is the normal heart valve is also compliant and not weak. Same, the size remains the same, but it's just that the walls are getting very stiff, as a result of which there is chances that the obstruction will occur because the blood flow is not going smoothly. Okay, next, what is the etiology? Mainly it is idiopathic. You know what idiopathic means? Idiopathic means the cause is not known. Know anything, just say idiopathic. Okay, next, it has the radiation fibrosis and amyloidosis. Amyloidosis, if you don't know, you have to read amyloidosis. Sarcoidosis, hemochromatosis related to your iron, right? Next, what is the morphology? In the gross, you are able to see normally or slightly enlarged heart. Okay. Micro, that depends on the cause basically. Either the amyloid deposit can be there, either the fibrosis can be there, or either the eosinophils will be there, right? What are the clinical features you have? In the clinical features, you have a right-sided heart failure. In the clinical features, first one you have is the right-sided heart failure. So remember, R for R, restrictive is for right-sided heart failure. Arrhythmias, irregular rhythms will be there. Investigations may first in investigation, first thing you have to order is the echo. Echo says that the ventricles are normal. In the MRI, you are able to see the infiltrates, and in the biopsy, you are able to see the deposition. Basically, either the depositions of amyloid or the fibrosis that are there. Next that you have is the arrhythmogenic right ventricular cardiomyopathy. So what is happening here? It is a genetic disease. Okay, it is a genetic disease. In this, the right ventricular myocardium is basically replaced by fat and fibrosis. Fat and fibrosis replace it. They will give you a history of what? They will give you a history of young adults with arrhythmia, and finally, young adults, arrhythmia finally leads to sudden cardiac death. That you have to remember. Investigation, first one is obviously MRI, then the biopsy that will occur. In the treatment, you have to give the transplantation, right? Next that you have is the secondary cardiomyopathies. In the secondary cardiomyopathies, what you have? First one is the storage disorders that you have. You have the Fabry's disease, glycogen storage disease, and hemochromatosis. And you know guys what? You have to read this all in your biochemistry, okay? Because that these disorders are given there very beautifully. Next, infiltratives, you have the amyloidosis or sarcoidosis. In the endocrine, you are having the thyrotoxicosis. Diabetes, the hero of endocrine. There are two heroes of the endocrine, diabetes and the thyroid. In the nutritional one, you have the alcohol, selenium deficiency, and the anthracyclines. They are nothing but the anthrax. Okay. Next you have is the stress-induced one, also called as the broken heart syndrome. Not your broken heart, right? What happens in this disease? It is basically after an emotional stress. Like if there are two brothers and they are having a dispute over the property. So what happens, the younger brother is so emotional that he never expected that my younger brother will say this kind of thing. So his heart is not able to take such thing, as a result of which what happened is he got a broken heart syndrome and he died on spot. Okay, similarly, you also sometimes get a broken heart, right? but that's not your broken heart syndrome. So what happens is it is a self-limiting in most of the cases, right? And the catecholamines are there, right? It mimics the myocardial infarction, but it is normal, right? It mimics the myocardial infarction, but it is normal. So don't relate your broken heart to this broken heart syndrome. Okay, I think we are good to go about this chapter. So what are the things that we have discussed? One more thing I will be telling you. We have discussed about the cardiomyopathies, dilated cardiomyopathy. See guys, I'm just marking some of the important topics that you have to read from here. Dilated cardiomyopathy is important. It can be asked as a short note, and this much is sufficient for you all to write. Then next thing is the hypertrophic cardiomyopathy. Please read. These two topics are super important, okay, in this. Now I am giving you a question, guys. You have to give me the answer for that. The question is, there is a young adult and he was participating in marathon. He died on spot. What's your diagnosis? Either it can be what? Dilated cardiomyopathy and the broken heart. So we have seen broken heart, it cannot be broken heart. Why? Because in broken heart you have to have an emotional background. An emotional thing should happen for broken heart. So it's not broken heart. Dilated cardiomyopathy, no. Then young adult, marathon, history of running is there, and he died on spot. Diagnosis should be HOCM. Okay, and I think we are done with this chapter. If you are having any sort of doubt, feel free to ask me. Feel free to DM me. Okay, thank you so much.